Hi, Matthew Holt on the TV Spotlight. I'm here with Andrea Ippolito. She is the CEO of Simplifed, which is a not that new, but newish company, and in the little area of postpartum care for women, particularly around lactation, is where it started. But Andrea, tell me what the idea was. You have been an entrepreneur. You did a scheduling company once. You ended up getting sold to
Mhm.
Athena. You've been doing sort of health tech for a long time, and now you're actually in the direct provision of care to women. So tell me, what was the idea behind this, and what are you doing?
Well, thanks so much for having me. So, Simply Fed has evolved to be this maternal care at home platform that has been centered on our core business of breastfeeding and baby feeding support. And how we got started is the fact that, when I had my first daughter, she was born early, underweight, and I had a heck of time breastfeeding. And here I am. I understand how to navigate healthcare. I'm married to a physician. And no one prepared me for what baby feeding would look like. And that's pretty wild because I live in a community that has the highest breastfeeding rates in New York State. We have the highest density of lactation consultants. So if there was anyone to succeed, it would be me. And I've never felt so lost. I felt like I failed my daughter because I didn't know how to feed her and my supply was low. And then I started looking into this and hearing from my peers and just in general a community and hearing that baby feeding was this incredible pain point, but quite literally a pain point, that toe curling pain, if you know, you know. And then, you mentioned I co-founded a previous company. It's called Smart Scheduling. It eventually got acquired by Athenahealth. I worked in telehealth since 2010. I like to say before telehealth was cool. I did research for the chairman of the Joint Chiefs of Staff on how to scale and implement telebehavioral health. And, I was a senior advisor to the secretary at the VA surrounding electronic health record modernization. So, like, I understand healthcare, and I understand healthcare policy in particular. And I learned that under the Affordable Care Act, health plans are required to cover lactation support, but the vast majority of health plans were in compliance with this policy. And, as an entrepreneur, you got to follow the money and learn that, holy moly, wait, there's a federal mandate for these services. There are board certified health professionals and there are reimbursement codes. And yet this wasn't integrated into the majority of folks' maternal health care experience. It's very rarely in healthcare that you get to be part of really expanding a category. This is a specialty after all. OB is a type of primary care, and breastfeeding and baby feeding support is a specialty. And so what we did with Simply Fed is launch originally this virtual breastfeeding and baby feeding support platform. And we went out and got a whole bunch of health plan contracts. So, as an example, we have national commercial contracts with folks like Aetna, United Choice Plus. We serve most, if not all, Medicaid beneficiaries in New York, New Jersey, Colorado, North Carolina, Tennessee, Florida, Washington State, and we're expanding to many, many more over the next few months. We serve all military families via our Humana Health Net Federal Services contract. So we went and got all these health plan contracts. And then we started partnering with healthcare systems so that we could really elevate this specialty because it is a specialty into the maternal care pathway. And we partner right now with over 300 healthcare systems and practices. But we learned in the process of doing all that, and we also know from our lived experience, I'm also a patient on the platform. I've had 10 appointments fully covered by my health insurance. By the way, no copay, because that's my right under federal law, not just as the leader of this company, but as a patient. But we learned that because baby feeding is this no days off, no nights off activity, you're doing every 2 to 3 hours, you need support. And because of how the global maternity bundle is set up, there's just a vacuum of care in the postpartum period. And so our health plan and health system partners would tell us, you're the only ones reaching families in the postpartum period for a variety of those, infrastructure regions. Happy to go more into that in detail. So can you do more? Can you do remote blood pressure monitoring to combat the rising rates of preeclampsia that has doubled since 2007? It's been accelerating since 2014. Can you do remote gestational diabetes monitoring? Can you do maternal mental health screening to combat the 20% of women that are now diagnosed with perinatal mood and anxiety disorder? Because you're the ones reaching these families and you have a crazy high NPS score over 90. They trust you. You're working with families in this longitudinal ongoing way. So we've evolved to be this much broader platform surrounding maternal health care and delivering it in their home settings.
All right, you said a lot there, but The start, so there's the immediate postpartum part where, breastfeeding is a big deal, and you can figure that out, and we'll see a little bit. You're going to show us a little bit how that actually looks in a second. And then there's some of the stuff you talked about, which is before, and some which is also, later postpartum, like sort of depression and just other mood disorders afterwards, can happen, can come sometime later. All of these things you said are very underserved. So let's first off, great, you get coverage. You said there was coverage and no one cared, right? No one was supplying, at least around the around the
Very
lactation
few.
stuff. And it was probably being done, and I guarantee you that it's one of those things where gets lost in the wash and women don't realize it's a problem, and they might have one consult in the hospital or something. But how do
Exactly.
you get Simply Fed into sort of the workflow? So what actually happens? There are labor and delivery units all over America. As you said, a lot of people from I think 50% of Americans who now give birth are now covered by Medicaid. So it's a big plan. But it's obviously in multiple different types of health systems. How did you get into the workflow, and what does that actually mean in practice for how new mums and families are being connected to you?
So what we learned throughout this experience is that, it's not enough, right, to have a health plan contract. It's
Sure.
similar, like if a tree falls in the woods, right? But what our vision is to really elevate this as a specialty within the maternal care pathway. And so what that looks like in practice is partnering with OBs. And the key thing is that referral needs to come during pregnancy. I'm sure you're wondering, why would a baby feeding company that very squarely is in the postpartum period want to be serving families prenatally? Well, here's why. Because your milk, when it comes in, it's droplets at first. And it often takes 2 to 5 days to come in. And if no one has told you that, then you think you're failing before you've had the chance to succeed. So a lot of what happens is if no one has educated you, or you've gotten the chance to really develop a baby feeding plan, no matter how you want to feed your baby, whether that's formula feeding or breastfeeding or pumping, whatever that looks like to you, then you're set up to fail because no one has educated you on that. So we partner with OBs. And the key thing is, as we all know in health technology, is that it's got to be integrated in their workflow. Asking an overworked, overburdened provider to do one other click is just not going to work. That's not what they need. That's not what they deserve. They deserve seamless integration into their workflow. So what we've done is we, as an organization, via our maternal health operating system, are interoperable with most of the major electronic medical record vendors. So Epic, ECW, Athenahealth, just to name a few. And what happens is we get added to typically the 28-week prenatal order set. This is the order set that contains that glucose test that you have to chug. Again, if you know, you know. So we're baked into that order set. And so once a patient hits that prenatal appointment, then their patients automatically and frictionlessly get referred to us. And the way we do that is we get their what's called a CCDA file, which is structured data. And then we can then proactively reach out to the patient and get them scheduled at a convenient time for them. And we also often have access to their health plan information. So it's just an easier onboarding for the patient who's super busy, they're pregnant, they don't want to have to fill out, another thing with their health plan information. So as much as possible, we try to get it, but sometimes we don't. And then we
So
have to
do
ask
they
them.
do they have is there typically a pre-birth consult, or what happens next?
So what happens next is we do an hour prenatal appointment that is delivered virtually, and we meet with the patient one-on-one. We have a national network of providers. All of our providers are internationally board certified lactation consultants, many of which are also nurses and nurse practitioners as well. And that's a requirement of Medicaid in most states. And so we meet with them for an hour, do a lot of listening to understand their goals, and then based on those goals, talk about, what does baby feeding look like, especially in those early days. If pumping is part of those goals, making sure they order an insurance covered pump. We go through, pumping basics. Depending on what their goals are, we really design a very inclusive plan, whether you're formula feeding, breastfeeding, or pumping. And that's a real differentiator of Simply Fed too, is, meeting families where they're at, no matter how they feed their baby. And so that hour appointment is so critical to our model because it allows us to build that relationship, but also set expectations so a parent can be very successful.
I'm sure that's, really useful for those moms. What roughly what share of mums take you up on that? If that's in the 28-week order set, there's like you have a high proportion. And then the next question is how many mums need it, right? So how many mums have enough problems that they need a series of lactation consults afterwards, or is it a nice thing to have that most of them want to do anyway? Give me a sense of the sort of the waterfall. If 100% get the order set and do the glucose test, how many are coming and taking that hour prenatal care, and then how many actually need you?
Our longest running healthcare system relationships, we're at 80% conversion.
Oh wow,
And I
80%
would,
take that for 1 hour. That's
yeah.
okay.
And well, 80% become patients. And then a large majority of those start during pregnancy. Now, there are a lot of folks that are like, why would I start this until after a baby's born? And so that's where our team comes in and does a lot of education
Yep.
and reaching out to them. But yeah, it's 80% conversion for our longest running healthcare system
Okay. So
relationships.
that's great. So it's basically a sort of matter of coursing. So why let's take a look. So you just told me that you weren't hang on. SimpliFed wasn't around for your first baby, but you just had another one just a few months back. So now you're a patient. So why don't you show me really briefly, just break up. I know you've got a quick video of what the experience is like. So just bring that up.
All right. So once your healthcare provider refers to us, what we do is then reach out to you, get you scheduled at a convenient time for you. You can either access our appointment or your appointment via text or your email. We send you a secure link, or you can do it via our mobile application. It just depends on the patient's preference. And then once you're ready for your appointment or at your appointment time, you can go to our app or go directly to the link in your text message. And then you can start your session, just like how any regular Zoom meeting starts. And then you'll enter, and then you'll meet one-on-one with one of our providers. And this is done from the comfort and safety of your own home. This is actually me. This is with my third daughter, Judy. And as folks know, this is what postpartum looks like, is you have baby in one arm and you have your phone in your other, and you're able to get that support and ask questions and work through your latch and positioning. And then after the appointment, we work with you and send any resources. We get you scheduled for your follow-on appointments, because baby feeding is this no days off, no nights off activity. And so your baby feeding journey will evolve over time. And so what we'll do is, send you different resources and materials. Maybe that's milk storage guidelines. We'll get you scheduled. Sometimes that happens at the end of the appointment. But the key thing is here is what we're meeting you where you're at. And your journey is going to evolve. You're going to eventually want to maybe start pumping more as you transition back to work, introducing formula. You might have toe curling pain and want to really get support ASAP because you are, don't want to go on any further and you just have questions and want to work through that. Your supply might dip all of a sudden. And so being able to reach families in their own home, and especially we serve all lines of business, commercial, Medicaid, and TRICARE. And if you have other kiddos around, you don't have access to transportation, it's so critical that you're able to access this in your own home.
So that's fabulous. So now someone's in the program. I assume some people are like, I've done it once, I've had one meeting, I'm good. It's easy, it's fine, it's working well, but might need to come back when they're talking about pumping or going back to work. Others may have real trouble, getting the baby to latch and milk, and may need a lot more support. And I'm sure it's all over the map. But give me a sense of what sort of average number of visits and number of and length of time that people need your service for, just on the lactation part.
So we do one prenatal appointment and up to 5 postpartum appointments. We can go longer as well, but most of our health plan contracts cover 6 appointments. And that's what, the evidence shows, is having this longitudinal model really moves the needle, and you can really work with families in this ongoing way. But that's typically what it looks like.
So that's all bundle and sort of free. If they need more help, I assume someone can book one and pay you cash, or pay direct, or pay for insurance or something. Is there another option? If you said you'd had 10, I think, so you might be abusing the system. I don't know.
Well, that's let me just put it this way. Our least paying health plan contract covers 6.
I see.
We have unlimited appointment coverage with many health plans as well.
Well, that's great. Okay, so there's a variety there. That's good to know. I guess the other question then is, let's talk about the other things, right? You mentioned that you're starting to be asked about blood pressure for preeclampsia, which obviously is, I don't know when that starts, but back in the week of the 20s, I would guess. And then you mentioned postpartum depression. You had a different term for it, which I think is the more encompassing one, postpartum.
Perinatal mood and anxiety disorder.
Perinatal mood and anxiety disorder. That includes, I assume, postpartum depression, but it is wider. I
Correct.
know there's a lot of baby blues and there's a lot of,
Hmm.
and again, these are things which traditionally, I know that men and women sort of stop going to their OBGYN and then go to the pediatrician who's not really looking after the mum, looking after the kid. So the kid's a bunch of scheduled visits, but the mum doesn't really. So that's an area where there's a lot of problems. And we know there's been a lot of issues with that. So it's a great thing to pick up. And what happens if somebody's in the process of that? How much of that are you taking care of with your professionals, and how much are you acting as a sort of almost like first line of primary care for the mum and pushing them onto other or referring to other providers? How does that work?
So, especially in the postpartum period, we're often one of the only folks reaching parents. And I should also say that, once we do an appointment with the patient, we're sharing the notes back with whoever referred them to us. So we're really an extension of their practice, whether that's OB, primary care, pediatrician, family medicine. And so, it is very important to us that as we identify any other needs, that we're referring back to the provider that referred to us, or another stakeholder specialty where they could use support. So we started evolving a model to offer these other aspects for especially rising and high risk patients. We do have many healthcare systems that refer all their patients to us for this broader suite of needs. So it doesn't just have to be with rising or high risk. But typically, if someone is rising or high risk for hypertension or preeclampsia, the OB will refer to us, and then we'll start serving them with remote blood pressure monitoring. This is cellular enabled. Once that referral comes to us, within 72 hours, we drop ship that cellular enabled blood pressure cuff. It's all connected via our technology stack and system. We like to say we punch way above our weight for a baby feeding services company. So we drop ship that cellular enabled device. One of our members of our care team reaches out, make sure they know how to use the device. And then, we educate them on when's the best time to take those readings. And because it's cellular enabled, those readings come directly to us. And so it doesn't require any input into an app. And then we're monitoring them. And we have all the right alerting, pager duty systems in place so that if someone starts to rise at certain clinical thresholds that we've gotten, authorized by their OB, et cetera, then we alert them, we refer them back to the right resources. Often that does include the ER if it's rising at such a fast clip. We're really the eyes and ears to really be proactively monitoring before any real large emergent need arises. And as someone who had preeclampsia, I did not have that. This is also with my first kiddo, and it can happen extremely quickly. And the fact that we're monitoring these patients daily, sometimes multiple times a day, just does incredible wonders to really proactively tackling this for patients, which is grossly missing from the maternal care pathway right now. Same thing with maternal mental health screening. We do a maternal mental health screen before every single appointment. And then next year, we're starting to layer in remote gestational diabetes monitoring.
All right, so there's a lot going on there. Last question about sort of how it works is that we've talked a lot about telehealth over the years. You've been buried in that for many years, as you know, with the VA and also Athena and elsewhere. But I guess that there's a sort of question about how people are managing the hybrid connection between, is telehealth is one thing, it's out there on the side, or is it done to the hybrid? How do you communicate back and forth and refer to us, and or if people don't have typical, consistent primary care, as many people in the Medicaid program struggle with that connection. How are you managing that sort of what you're doing on the telehealth world with the actual physical world and coordinating that sort of hybrid care approach? Or is that not needed? Can you basically do 95% of this in telehealth? Just give me a sense of where you are.
Yeah, great question. So this is the power of the fact that our platform is interoperable with most major EMR vendors. So, we like to say that most of lactation care can be delivered virtually, but it is personal preference, right? And we need to be responsive to patients' needs if weight checks are needed, if they do prefer to have in-person care. And so, we're here to serve the patient. I love Miracle on 34th Street when Santa's referring out to his competitors, like, we'll refer out to people that are not us because that's what's right for the patient always. I do think a lot of lactation care can be delivered virtually. Again, I can say that as a patient. And it's because you're building that muscle memory and you're on the couch where you're going to be baby feeding and breastfeeding. So our providers work with you and say, okay, take that pillow, put it underneath your elbow. Let's get belly to belly. I see you're in pain. Let's get a more optimal latch. Whereas when you often get lactation care and it's in person, which by the way is super needed too. So it can be both. It should be both, especially in labor and delivery and those early pediatric appointments. In-person care is phenomenal. And building the muscle memory yourself when you're in your own home in the place you're going to be baby feeding just improves compliance and improves your self-efficacy. You feel more empowered, you feel more confident because you know how to do it and you're going to be doing it in the place that you are going to be baby feeding. And if we do need to refer back for resources, we're interoperable. So we're sending the note back. We're saying, this is what we talked about with the patient. We do think that in-person lactation care is needed and amplified. And the other thing is OBs love working with us because we are willing to refer back and we're taking care of their patients when they don't have the time or appointments and availability. They're super overburdened. We have a huge national shortage of many providers, but especially OBs in this country. So we're really extending their reach and working with their families in an ongoing way, which they don't have the time and capacity to do, nor do they get paid for due to how the global maternity bundle is set up. I'm happy to share more on that. And we're willing to be held accountable to clinical outcomes and metrics. And that's something we take extremely seriously. So all of those factors is how we've really been able to develop this strong relationship, but also how we handle hybrid care as well.
All right. So at the moment, well, let me ask you a question. Can you foresee a time where you might have your own, you know, bricks and mortar, or maybe not bricks and mortar, but actual in-person, network who work for you rather than work for a health system or for an OB care, or you think you'll just be a virtual player that continues to connect with all those current providers?
Most likely a virtual player that connects, but never say never. I also think, our vision is to raise this as a specialty, which it is, breasts or organs. And it's true. And we, in much of women's health, don't take women's health needs very seriously. Baby feeding and breastfeeding is so deeply connected to baby's health, of course, but it's really deeply connected to mom's physical and mental health, whether you're formula feeding or breastfeeding or all the things above. So this is a specialty and it's long overdue to be considered a specialty. And whether that's us remaining fully virtual, us being hybrid and evolving that, I think, and I see from our data and our revenue and the interest commercially that this could be that too. And it's time we start really prioritizing women's health as the business opportunity that it is.
Amazing. All right. Well, look, I think that's a great answer. You've found a really important niche there. Tell me a little bit about the business. I know you started this you were starting in 21 and got funded right at the end of 21, early 22, first time around. So give me a sense of what that was. Going and explaining to a bunch of male venture capitalists about breastfeeding was, I'm sure, fun and games. And then what's the evolution? You've done a lot in only a couple of years. So give me a sense of the evolution of what the business has been like in building this out and where you are now.
Yeah, well, thanks so much for that question. And one thing to share is it's not a niche business. This, one of the top questions that we get from investors are, this feels like a point solution. This is a longitudinal model that is designed around patients' needs, that has reimbursement. Do I wish it was higher? Of course. I'm an entrepreneur. Of course, I want the reimbursement higher, but it's strong. And as we've evolved to be this maternal care home platform where there's this vacuum of care in the postpartum period, we're comprehensively tackling the health of families in this period, and it's a huge business opportunity. So it's not just a niche business, it's huge. And again, it's time we start talking about maternal health and more broadly women's health that way. But to directly answer your question, we raised in 2022, it was of the frothy times. But I think because of the work we've done, especially working with B2B partners on the health system and health plan side, is we've been able to overcome some of the concerns of businesses invested in that period. And we have, a strong financial model, strong unit economics, and we found a way to create frictionless referrals baked into the healthcare system. And that has boded well for us, and it's boded well for us in bringing in additional financing on, and it's been allowed us to be, one of the category leaders in this arena.
So tell me how much you raised, and give me a sense about the sort of the growth and number of patients or the number of people in the company, number of how you're working with your lactation consultants and NPs, and give me a sense of the sort of the scale of what you've got to so far. You mentioned 300 health systems, and give me a sense about how many more they need, you need to get to.
Yeah, great question. So we raised $6 million, and always bringing on more fuel to support our incredible scale journey that we're on right now. We've had close to 20,000 patients referred to us over the last year, since our first larger healthcare system relationships have gone live. And so we'll continue to scale and have a pretty exciting pipeline, not just with health systems, health plans, but other strategic partners that we'll be announcing in the coming 3 to 4 months. So stay tuned for more.
So how big can this get? There are you said 20,000 women so far, which is if you had to do your AR, your annual run rate of patients, what does it look like at the moment? How fast is that growing?
Well, we believe that every woman that is having a baby, or any parent that is going to be baby feeding, even if they're not the birthing parent, deserve access to the service. If you're exclusively formula feeding, you deserve access to the service. You deserve access to evidence-based support. And so, the way we think about it is we're really focused on, we can serve families in all 50 states, but we are very focused on key regions that I mentioned. And we go big in those states with working with all the major, 2,000 plus birth centers there. And so I named the states earlier. So we're working with many of the healthcare systems in those regions. And so we'll continue to scale in those regions, and then we'll continue planting flags across the US.
Right. My recollection is there's like 3.5 to 4 million births a year in America. And if you're doing 20,000, how many?
3.9.
Okay. Oh, it's pretty close. So
not too bad.
that gives you some room for growth, which is
there you go.
Which
exactly.
is all right. And tell me how's the company structured at the moment? How many people are in it, and what are the major challenges you've got? Well, you obviously overcome a lot on the interoperability front, which you knew was helpful from your previous years. But what else do you need to do other than just scale what you've got?
Yeah, I think in any health technology business, you have to think about, always keeping the patient's needs at the center and really designing your team around that. So we on the clinical ops side have an amazing clinical ops team. They have a deep bench of experience in healthcare. We have our ally team, which I should have called out more. They're the secret sauce, what makes SimpliFed so special. And they're the ones, once a referral comes to us, proactively reaching out to the patient, empathetically reaching out to them. Many of them have been patients on our platform. Many of them also, by the way, lactation consultants that are in training, so they can earn hours and serve as a mini residency program, and that helps us scale as we go. So we have our incredible network of providers. We have our allies, which are those peer mom navigators that are helping to schedule, et cetera, the virtual manifestation of the person at the front desk. Our clinical operations team that includes, our revenue cycle manager. You got to get paid, and especially in lactation, which even though lactation isn't technically a new specialty in health care years, it's newer. And when we're going into a health plan, we're often educating them on here's how you code for lactation care, here are the reimbursement codes. And so, that's our clinical ops side. And our care delivery side, we have an incredibly strong technology team led by Gaj Suthenra. I've known Gaj for, over a decade, from when he was at Boston Children's. We were presidential innovation fellows together. I was at the VA, he was at HHS, part of the ONC team. So he's such a whiz on interoperability and all things, one of the co-founders of One Up Health. And then we have just an incredible commercialization team that, fuels it and allows us to scale and grow to eventually get to that 3.9 million births per year, hopefully, or close to it. And that's led by Mary Hardy. And she's just, she likes to say decades of experience selling and working in healthcare. And another key to the whole shebang is customer success and having strong customer success. And that's one of the things that I learned just a tremendous amount since starting SimplyFed is the power of customer success to work with your clients to make sure they're happy, have what they need to accomplish their goals and their metrics. And so yeah, those are the big pieces. And of course, our marketing team, well, build top of funnel, but also educate patients, provide incredible materials so that patients have what they need and they're thoughtfully written, almost like if you're talking to your best friend that's an OB-GYN, you're, at brunch or at the playground with your kids.
Fantastic. So a lot going on. You've done a lot in just a relatively short time, Andrea. So congratulations on what SimplyFed's done so far. It's obviously a massive need, so well done on hitting that. And looking forward, sounds like there's a lot. You're starting the journey. There's a lot more to come. I've been talking with Andrea Ippolito. She is the CEO of SimplyFed, which is building out a new whole category around the sort of around the birth.
I love it.
Around the birth. I'll give you that for free.
Love it.
Okay.
I like it a lot.
Thanks for your time, Andrea.
Thank you. Have a good day.